Joining us now to analyze the coverage, Ben Domenech, founder and publisher of The Federalist. And in Ohio, Capri Cafaro, a former Democratic state senator there who teaches at American University. Ben, President Trump says he and Mike Pence are tested every day. But a reporter asked the president, how can you ask the country to go back to work when you can't protect the White House, where Secret Service agents have been infected, where now Anthony Fauci and the heads of the CDC, FDA are self-quarantining? And the president said, well, that could happen with or without testing. Should this be a big story?
Of course, it's a big story. I mean, we saw what happened in the United Kingdom, where Boris Johnson had to deal with this and ended up in an ICU for a time. Of course, it's significant whenever you have this level of outbreak happen at the center of American federal power. At the same time, I think people need to remind themselves how this testing process works. You're not going to get the kind of immediate turnaround that you'd like to see necessarily in terms of people being able to prevent themselves from getting this disease. And eventually it is likely to hit a number of people who are in significant positions of power. I think, frankly, it's surprising that it hasn't happened earlier, just given the close quarters that you see within the White House.
Capri, reporters have also challenged the president for not wearing a mask. Most recently, during a visit with World War II veterans, he says he was a considerable distance away. Is all of this a symbolic story or a real one?
I think it's both. I think certainly it is a story because the President of the United States is not only the commander-in-chief, but the communicator-in-chief. The Centers for Disease Control has gone out there, Dr. Birx, Dr. Fauci, and others publicly standing next to President Trump saying that they do recommend individuals wearing masks. Although Trump has said that he doesn't want to wear one and he doesn't necessarily think it is necessary, but there is, I think, a focus on the discrepancy of do as I say, but not as I do. But I also do think it is a symbolic story about having the government tell individual citizens what to do. And I think that the mask controversy boils down to that, and we're seeing that at the state level across the country of this, loggerheads between individuals that are saying we want the government to step off, and this is our own personal choice.
Ben, when Trump says he's disbanding the coronavirus task force, then he's not disbanding the task force. And I thought he was pretty candid about the political backlash that he got. Many of the pundits don't say, well, he made the right decision. They say, see, he's erratic and indecisive.
Well, I think that this is one of those situations where the constant criticism that so many pundits have made for these briefings led the president to just kind of say, well, let's just get rid of it then. Why are we even doing this thing? If we're trying to get information out to people and it's being depicted as being propagandistic or something of the like. Clearly, this is you're losing either way situation for the White House. One thing that I do want people to keep in mind, though, is that the timeline on this is so long, and the level to which this is going to be a factor in America for such a long time. We're not going to have a vaccine for, in all likelihood, at least another year in terms of the times that we're going to see here. And so at some point, you have to move beyond the task force mentality of this being a short-term, temporary, needed thing, and to an approach that is, frankly, part of every agency and every entity that needs to be focused on this. That's something that I think people need to get their minds around and hasn't necessarily been a regular part of the coverage that we've seen on various networks.
And, there hasn't been a coronavirus televised task force briefing, Capri, in 2 weeks now. Now, given the popularity of people like Anthony Fauci and Deborah Birx, their high poll numbers, I think the president knew full well that this was a popular task force. So was his aborted move more about trying to shift the media focus to reopening the country and getting people back to work?
I think that that's certainly an underlying factor. I think that President Trump, and who can blame him in an election year, is trying to move past this, sort of climate of crisis, focusing on the next steps, which is reopening the economy. I do also think that it's important to note that the media, I think, is really latched on to this story about trying to disband the task force. I think because it continues this narrative that President Trump doesn't want to listen to science. And I think that that the coronavirus task force stands for scientific experts, and I think they're trying to say, oh, you want to pivot away from this because you don't want to listen to science. You rather try to focus on the economy and the political implications. That being said, President Trump obviously decided to switch course and keep with the task force. I think we can anticipate, as he has already said, this task force will continue to evolve in its purpose.
On this question of science, the New York Times had a story the other day that caused a media explosion. I mean, I saw it on television, every hour. And that was the headline, U.S. quietly fears virus's daily toll will soon double. Story saying Trump administration privately projecting a steady rise in the number of coronavirus cases and deaths over the next several weeks. Ben, the administration disavowed this outside study, and its denial was in the 11th paragraph of the story. What did you make of that?
Mm-hmm. Well, I think it should have been a lot higher, frankly. Look, the predictions and models that we've seen from a variety of sources have been pretty consistently off in terms of the experience of this. Now, that's not to say that these aren't people who know what they're doing. I know many people who work within this area of industry, and from my time at HHS, I have a lot of respect for them. At the same time, models have a real difficulty of telling you what to expect when it comes to things that are very new and that behave in new and interesting and often terrible ways. And that ends up in a situation where we can't put all of our faith into that one basket. We can't have governmental decisions that are only based on the types of models that we see from various sources. They have to also factor in the different other aspects of decisions. And that's something that I think a lot of politicians have struggled with because they would much rather defer to experts in different varieties across the various states. Right. And yet that's not going to bail them out in this instance. They have to make hard decisions.
Yeah, and just to button this up, Capri, as the Washington Post correctly noted about this study that said could be 3,000 deaths a day, and who knows, it could be that high, maybe it won't be that high. This was a draft report by an outside academic who it was not reviewed by the task force, and the author himself said it was an FYI, it was a work in progress, and it was not a forecast, and yet I think it contributes when everybody repeats it, the notion that the media are helping to scare the hell out of the country.
Right. This IHMC study, was conducted by the University of Washington. I think that what happens is that the media tries to latch on to any and all information that they can get to try to, fill a 24-hour news cycle. I think they're also, again, trying to create this backdrop and create a counterpoint to, is this the right time to reopen the government, or reopen the economy? And so I think when these kind of studies come out, they latch onto it and they try to provide that counterpoint saying, is this the right time? Are we moving too fast? Is this political, or are we ignoring science? Again, it's that narrative that the press is trying to continue.
Right. Well, I think the problem with the media narratives is there's a supposition that you either are for saving lives or you're for saving jobs. When everybody, including Andrew Cuomo, says, you can't keep the economy shut down forever. We now have 14.7% unemployment. Steve Mnuchin telling us Fox News Sunday that a real number could be as high as 25%. But I want to close with this headline in the left-wing Huffington Post. Banner headline. Let's put it up on the screen, Ben. Donald Trump doesn't care if you die from coronavirus. And the story simply said, well, he has trouble expressing empathy. That seemed to me to be a classic case of Trump trauma.
It's just, this is the kind of coverage that I think is just ridiculous and doesn't help anybody. Of course, politicians don't want you to die. And when it gets framed like this by the media, it's just irresponsible. I mean, imagine, if right-wing entities were saying this during previous health challenges that happened under the Obama administration. You should not have this kind of coverage. It's deeply irresponsible.
And Capri, it's governors, Democratic and Republican, who are moving to open their states. You agree, but I didn't see any media criticism of this headline at all. It's just like, oh, well, another shot at the president because it's Trump. What really disappoints me right now is in the middle of a global pandemic where we do have millions of Americans out of work and thousands of Americans dying. People are petty, and everyone is retreating to their respective ideological echo chambers. Now is not the time for that. And this kind of thing from the Huffington Post, whether you're left or right, it's not the time for these kind of petty words.